what are the signs and symptoms of otitis media? So the signs and symptoms of otitis media, there is ear pain. When the child keeps having ear pain, that is one of the symptoms. Then there is a loss of appetite. There is trouble sleeping, trouble hearing in the ear that's blocked. There is also a feeling of fullness or pressure in one's ear. Then there is a yellow, brown, or white drainage from one's ear. This also happens to the ears. So with this kind of, these are some of the symptoms, and it's mainly advised that, you do not place anything in your ear canal. If you have a drainage from your ear, an item, drainage is, when you have maybe a liquid coming out, since I said there are swellings. So those are some of the, the signs and symptoms. And then, majorly about infants and children, since small children and infants can't always communicate their symptoms, it's important to recognize the signs of a child who has this kind of effect. So for kids, of course, those other signs I first talked about, those are the major signs for anyone, for the adults and for the children. But for the kids who may not always know, the only things that are, make it easy for you to detect that your child has otitis media, when they rub their ears consecutively, they cry more and, act very much fuzzy, and then they have a fever ranging from 100.5 to 104 degrees Fahrenheit. That is 38 to 40 degrees Celsius. So when they have those kind of situations or conditions, if you see them in your child or infant, that's when you know that they do have this, as well as when they start mouth breathing or have increased snoring. Mouth breathing may be a sign of enlarged of this kind of infection as well. And then there is when they refuse to eat during feedings, they have the pressure in the middle ear changes as your child swallows. So it causes more pain and less desire to eat. So you see how that also comes, in as an effect or a symptom. So when you see all those in the child, you can easily tell that, they have an ear infection or they do have otitis media. So is this ear infection contagious or not? And what are the risk factors for this infection? So the risk factors for this kind of infection include age. So infants and young children between 6 months and 2 years are at a greater risk for this kind of infection. Then family history, when getting ear infections, this can also run in the family, with the lineage and all that. Then having a cold increases one's risk of developing an ear infection, especially children in daycare and group settings are very much at a greater risk of getting otitis media or having this kind of ear infection. So there is chronic illnesses as well, like long-term illnesses, including immune deficiency and chronic respiratory diseases. These also, such as cystic fibrosis and asthma. These also have, the people with such diseases, chronic diseases, have a higher chance, or they are risk factors, or they can easily get this. And then as well as poor air quality and smoky environment, exposure to toxins in the air, secondhand smoke increase one's risk of getting this kind of ear infection. So doctor, one thing I do know is, do we have these kinds of infections really being popular? I know they do happen, but do we have people actually being alert or taking concern of these kind of infections?
Yeah, when you become a parent, you really have to be ready for such. Our kids just get sick. they get sick actually, and it's a little bit scary for them to get sick, most especially in that weird time, because at the end of the day you can go to bed with them and then you are like, and because they can't really communicate exactly what is affecting them, it makes it a little bit hard. So that's why it is a little bit better for someone to have a lot of time with their kids, because you never know what is really, really, really affecting them. Now, ears are one of the most complex parts of the body that can so much affect kids. I mean, that we don't so much take good care of, most especially when the kid is growing. They can be in a position to put in anything. Actually, sometimes it's not even advisable for someone to pick their ears. before the presence of their kids, because the kid can be in position to pick anything and they put it there in a way of trying to imitate and you know, try to solve. So it's a very serious problem, but most of these problems our people don't know exactly what to do about them too. They go about them in a traditional kind of way. So if someone has been in position to get to know about it, we encourage them to go and seek medical attention. We don't have a lot of ear specialists in this country, by the way. We don't have. I had a friend of mine, he had we looked for an ENT, you know ENT?
Yes,
he had not, you know, a throat specialist. We got him at Lifeline Hospital in Ntinda, but that was after moving around Kampala for the last, for almost 5 hours. And he gave us an appointment the following day at 5 a.m. in the morning, and the brother was dying. So it's yes, now the president is encouraging us to go in for sciences. I think that should be one of the special areas where people should be in position to. We don't have those specialties here. That's why our people keep on dying, you know, fake diseases. Maybe
without knowing the major cause,
without really knowing. So when you're a parent, you should be in position to be ready for such. The fact that most of the people that get affected by otitis media are kids, so that gives us a little bit of a leeway as mature people. But this also calls for caution. We should be a little bit cautious when it comes to looking after our children. It's a little bit easier for moms to do that. You know, when a mom is playing with a kid, they turn them around, you know. So as also men, parents, men should also get in, because at the end of the day, your kid might be suffering seriously, but because they don't know exactly how to articulate, how to speak out exactly what is affecting them, they can get seriously hurt. So it's one of the precautions that we need to take. Let's get involved.
Yes, so that is what we had for you today in our health tips. Some of the complications that come from this otitis media, there is hearing problems. You can get a temporary hearing loss, or problems hearing, your hearing kind of changes. And then we have our children may able to fail to learn languages very fast. For one to learn languages, they must hear and tell, the difference with all this. So those are some of the temporary, some of the complications that come on with these kinds of ear infections, as well as spreading the infection. So there is a hearing loss, it's temporary though. And then there is a time or, failure to adjust to learn languages if in time for the kids. So that is what we know for you, otitis media. It can be diagnosed, so you can always look out for the signs that we have mentioned, and in case your child has them, and you can always look out for medical help.